When we picture the gender digital divide, we likely imagine a woman living in a rural area who doesn't have an advanced education and doesn't own a smartphone. She's effectively cut off from web based information and services. But the isolation that's caused by the digital divide takes many forms. What about the community health worker who's concerned she'll be replaced by someone younger and more tech savvy? Or the facility based nurse who's feeling overwhelmed because she has to learn yet another digital technology. What if I were to tell you that within the organizations working on digital health, there are women feeling affected and isolated by the digital divide? They are often the only woman in a design meeting. And when they are there, they're often asked to make coffee or take notes, while their male counterparts aren't. My name is Lauren Wall. I'm a digital development specialist and gender advocate. And during my WomenLift journey, I've been the director of programs of Digital Square at Path. So let's rewind just a little bit. Gender shapes who holds power, who gets access to care, and whose needs are prioritized within a health system. Around 70% of the health workforce is women, but women only hold about 25% of health workforce leadership roles. Women are also more likely to be care seekers for themselves and for their families. But when we think about the digital divide, we see that women are 13% less likely than men to own a smartphone, and they're 15% less likely to access mobile internet. That means there are 785 million women in the world that still aren't accessing this new social determinant of health. So when we're thinking about digital health interventions, if we're not thinking about the digital divide, we risk a poor implementation or even worsening gender inequities. Yet, digital health practitioners are facing real barriers when it comes to gender integration. So during my WomenLift project, I conducted a rapid analysis of the barriers being faced by digital health practitioners. I conducted interviews and surveys, mostly with those working for NGOs, and their job titles were things from project director to business analyst to software developer. Four key themes arose. Here are the first three. Lack of awareness and understanding. Many people working in digital health have no idea what gender integration is, much less how to practice it. Second, those that are aware of gender integration and want to practice it don't have the confidence or the tools or the skills needed to do so. That brings us to our third point. There aren't very many tools, guidance documents, or frameworks for digital health and gender integration. Those that do exist are rather nascent or they're not well disseminated. Most people I talked to, even when they were looking for these things and wanted to use them, had no idea they existed. But the fourth theme was internal organizational bias. The wording of the survey and the interviews was very specific to ask only about gender integration in digital health programming and to completely avoid internal organizational bias. So I was really surprised when this continued to bubble up in all of my conversations. Things like gendered hiring practices, gendered roles within teams, or gendered workplace dynamics. And these ultimately are making it harder for people to prioritize gender equity in their externally facing programming. So, what do? Well, there are frameworks to address gender integration in digital health, and more are coming. So, find them and use them. Second, gender analyses should be conducted, so organizations should be planning for them and donors should be planning to fund them. Also, organizations can provide gender integration training for their teams. Gender integration is not the sole responsibility of the gender specialist or worse, the one woman on the team. Now, these three can be applied to any sort of health programming, not just digital health. And then for me, what's next is I'll be moving soon to a role that will focus solely on closing the gender digital divide. And throughout my year at WomenLift, I've been really grateful to have the time to dedicate to this topic and a cohort of exceptional women leaders to encourage me to do so. Thanks so much for your time.